The way the US pays for nurses is a broken, regressive model. Of all the ways in which I think the healthcare system has devalued nursing, nothing is as a culprit in that as the payment system, as the billing process. Unfortunately, nurses don't get to participate in the fee-for-service model that medical providers do. Medical providers get to charge and bill and be reimbursed directly for their professional service that they render. Nurses are professionals too. We are licensed professionals. We have the same role of a professional. We have the responsibility and liabilities of a professional. And we have the education, knowledge, and training of professional. And professional nursing services should be called out in the bill. And unfortunately, one of the ways in which we have been deprofessionalized in the system is we work in these environments that only see us as labor to exploit, as a liability and an expense. And this hasn't always been the case. Back in the early 1900s, nurses worked as independent contractors. We were seen as a professional provider in nursing, and we were hired, we billed directly, and we were reimbursed directly. In the 1930s, the healthcare industry wanted to change it up. They were doing insurance reform, and they looked to other industries to see what payment models they were using. The hotel industry had a model in which they rolled in housekeeping services and other amenities into one room and board charge. The hospital industry saw this as a viable model for healthcare, and they adopted it. And unfortunately, in that process, nursing services got folded into just a basic room fee. So we are really nothing more from the lens of the business of healthcare as just an expense, a liability, as jello, as janitorial services. And we are not regarded as the professionals that we really are. We know that nurses are essential to healthcare delivery. Medical providers manage the medical plan of care. They're managing the pathology. Nurse providers manage the human and the human response to their medical care. You cannot have a healthcare enterprise without the nurse provider. The nurse provider and the medical provider need to work in partnership to deliver comprehensive care. In any other industry, if they looked at the technical skills that we offer, the critical thinking, the reasoning, the clinical prowess and acumen that we have to take care of things, we would be regarded as a professional service. One of the ways I think nurses are going to get the recognition for what we offer and contribute to the enterprise, to outcomes, to safety, to quality, we are the caregivers. We are the ones delivering the actual care. The way that we're going to get recognized for this, I think, fundamentally begins with a payment paradigm shift. Reimagine how we bill for our professional services.